Welcome back. Tonight, our positivity rate is at 5%. While the number of cases per day is much lower now than what we've seen, the number of deaths in our state are staggering. Almost 17,000 people have died from COVID here in Arizona.
As positivity rates rose, death rates soared. Governor Ducey said he was listening to our health experts. But as our Chris Pickle reports tonight, members of a nonpartisan COVID-19 modeling group who report their findings to the state health department say the governor, who, by the way, declined to comment on this story, ignored their warnings.
When you look at the sheer number of the people in Arizona who have died, were a lot of those deaths preventable?
Yes.
An evaluation that's not based on hindsight, but science and information provided to Governor Doug Ducey throughout the pandemic.
Are you saying that Governor Ducey's decisions and actions led to the deaths of Arizonans?
His decisions led to more cases than otherwise would have happened, and some of those cases resulted in hospitalizations and deaths.
Dr. Joe Gerald is one of the leaders of a modeling group made up of dozens of experts from NAU, U of A, and ASU. Over the last year, the group, analyzing massive amounts of data, was able to forecast the course of the pandemic up to 2 months out, giving the health department weekly updates.
How accurate would you say your team has been?
We've done a very good job of understanding how bad things were going to get.
Through executive orders, Governor Ducey set policies how Arizona would maneuver through the pandemic, frequently claiming to be following the advice of health experts.
I'm being guided by public health and the Centers for Disease Control. As I receive the guidance in alignment with CDC and Dr. Kara Christ, I will be changing those directives. The pressure should be to do the right thing. The pressure should be to follow public health.
Would you agree that he is listening to the health experts?
It's difficult to understand how that's true.
After months of not turning over public records I requested, the Arizona Department of Health Services released the notes from the modeling group's meetings, but only after Arizona's family and lawyers from the First Amendment Coalition moved to bring a lawsuit to get the documents. Our goal, to see what information the governor was provided before making his decisions on how to handle the pandemic. Dr. Gerald says, as the pandemic progressed, the governor prioritized the economy over public health.
I think it was a calculated decision to allow this virus to transmit more widely in an effort to save some of the economic activity that would have been lost with the targeted business closures.
We charted the COVID cases and executive orders given by the governor to slow the spread. The first wave in late March, with less than 200 new daily cases, Governor Ducey issued a stay-at-home order. Just 1 month later, with new cases at around 400 a day, the governor began reopening the economy, easing restrictions on non-essential businesses. He also signed an executive order preventing local leaders from issuing mask mandates. Those moves came on the same day then President Donald Trump, who was calling for governors to reopen the country, announced he was coming to visit Arizona. Arizona's second wave was beginning, cases increasing for 6 weeks. In June, the governor limited events to 50 people. With new cases surging over 3,000 a day, the governor closed bars, gyms, and movie theaters and allowed local leaders to issue mask mandates. Cases began to drop. In July, the governor allowed restaurants to operate at 50% capacity. Cases flattened. Under the governor's orders, schools offered in-person instruction. Concerns were raised as people began to travel for the holidays. The third wave began in October and would hit levels higher than any other time during the pandemic. The governor expanded outdoor dining. Cases peaked in January at more than 12,000 cases in one day. Looking at the data, each surge in cases brought a surge in deaths, more than 10,000 in the third wave. According to Dr. Gerald, the modeling group gave dire warnings, laying out recommendations to slow the spread of the virus, including closing some businesses that attract crowds.
In this report, you said this crisis will revolve into a humanitarian crisis leading to hundreds of preventable deaths. Did that happen?
It did.
You laid out a plan that possibly could have prevented some of these deaths, and the governor did not listen to it.
That's correct.
What was your reaction when you saw what the governor was doing?
Frustration. It was like watching a train wreck. You knew the collision was going to happen, but you were powerless to do something to thwart it.
As cases now creep back up across the country, Governor Ducey has virtually no restrictions in place to prevent a fourth wave in Arizona. Dr. Gerald calls the governor's most recent order lifting almost all restrictions premature.
You're a professor. If you were going to grade Governor Ducey's performance, his decisions during the pandemic, what grade would you give him?
He started off fairly well. I would have given a B, but as time wore on, he just seemed to lose the interest in his studies, stopped turning in assignments basically, and so he would end with a grade of D.
If you were going to give him one piece of advice moving forward, what would it be?
That time has come and gone. I think what we learned through this pandemic, it's every man and woman and child for themselves in Arizona. And you have a responsibility to protect yourself because the governor's office and our state government is not going to do it.
And it's not just Dr. Gerald. Over the last year, I have talked to several members of this modeling group who have shared the same concerns that the governor was not prioritizing public health, but they were not comfortable going on camera because of fear of retaliation. Now, again, we asked to interview the governor for this story, but his office declined my requests.
And Chris, a lot of people are getting vaccinated right now in Arizona, right? Everyone 16 and up now eligible for the shot. Despite that effort, there are concerns that other states are beginning to now see what is called a fourth wave. What does Dr. Gerald forecast for all of us here in Arizona?
Well, we are seeing an increase in cases, but Dr. Gerald says if you look at the current data, Arizona probably will not see another surge like we did in the fall, partly due to vaccinations and due to the fact that so many people have already had the virus. So Arizona has more people with immunity than many other states. But remember, that comes at the cost of a lot of people getting sick and dying. Arizona is actually 6th in the country for cases and deaths per capita.
All right, so Chris, this modeling group, which you highlighted in that story tonight, they give all their information to the state health department. What have they been doing with all that information?
Well, I asked about that, and late tonight, the health department finally got back to me and said they appreciate the modeling group's efforts, although ADHS, which is headed by Dr. Kara Christ, does not always agree with their predictions or recommendations, and that they have other health experts that they work with. But we do want to point out that this modeling group continues to provide their information to the state.
And that is our CBS 5's Chris Pickle with that investigative report. Chris, thank you.